Today, I am going to tell you my grandmother's story of her experience in an ICU in a hospital. Her problem started when she could not eat solid foods, and she used to tell us there was some obstruction in the food pipe, the esophagus. So she lived on fluids for quite a long time. But she was old enough and had become very weak without good food. And over time, she could not swallow even fluids. That became very difficult. So she was admitted to a hospital. I was a student then. The doctors there said there was a cancerous growth in the esophagus. The oncologists and the surgeons felt the tumor should be surgically removed. But it was risky, looking at her age and health conditions and other things. So they asked my grandmother for her opinion. She said, "You are the best judge, you do what is best." And so she underwent surgery. They had to cut open the chest, cut a few ribs, and enter thorax. The lump was there quite deep inside. The surgery went on for some 8 hours, and it was not successful. The surgeons saw that the tumor had spread to all the neighboring organs and it was risky to remove it, and so they closed the wound and sutured it. This left her further weak, debilitated, and more pathetic. She developed other complications also. And though the doctors knew very well that she would not recover, they continued their regimental treatments like ventilator, oxygen mask, the digoxins and stimulants and so on. They would not give up. And my grandmother used to beg them, request them, "Doctor, allow me to die." But they were reluctant. And she died in the ICU after a month-long suffering of pain and loneliness. She said, "Loneliness is more painful than cancer." It's a very old, sad story. Now I am myself very old, but the picture of that treacherous dictatorial treatment given to her lingers in my mind as if it is quite fresh. Now I have come to see what is aging, what is growing old. While we grow old, you see, all the parts of the body gradually shrink and lose their weight and mass. All the functions decline and slow down as we age. This downhill journey is natural, it is painless, and it ends in a pleasant death. Look, for example, your teeth. Though a tooth is the hardest substance in the body, it wears out in time. It shrinks and becomes brittle, however much you brush with the best toothpastes. The jaw and the tissues in the mouth lose their mass and strength to bite hard stuffs, and you cannot rebuild it. It is final and not reversible. This is my story of an old aging man. But as a doctor, I have a different story to tell you. We doctors don't know what about aging and natural death. Our medical textbooks nowhere mention how to assist elderly or helping people face a natural, inevitable death. On the contrary, we are trained to save lives and fight death. Giving life is a victory for us, and not being able to do so is a failure. If a patient dies, it is seen as our failure somewhere. We hate death and aging. Therefore, doctors are very unprepared to help a dying person. But 50 years ago, people died in their own homes and their family members knew how to deal with death. Now, most people die in hospitals at the hands of doctors and other staff who are not at all trained in this area. Now take a look at the patient's story. Patients in their old age often live in a delusion, believing that their life can be prolonged, their health could be regained, and they can get the youthfulness. And they believe doctors will do that. Doctors also live in the same delusion. They don't know that it is impossible to reverse aging. It is impossible to conquer death. They are in a confusion. We are dedicated to curing illnesses, whether it is a cancer or a coma. Doctor's job is to cure. Doctors often therefore go to extreme lengths with treatments, with ventilators, pacemakers and so on. So, they have to put the patient locked in an ICU and start fighting death. This mindset has created a lot of inhuman acts, callousness and unspeakable misery for the patients. So it would be welcome if doctors would take time to look at the reality of a terminal illness with an open mind and allow them their freedom to choose a painless, natural death. Patients do not know, but doctors know that they are going to die anyway. Our people live with a self-respect, dignity and honor while they are living healthily. I wish they should die with the same dignity, same honor. Why should they die like a victim in an ICU, cursing their fate? Why should they take the punishment of living with an oxygen mask? Why should they be deprived of dying at their home, being assisted by loving family members? So, however hard it is, people should choose to die at their own homes in the midst of their family members with all dignity and honor. I think one must die like a Buddha, isn't it? Think about it, right? Thank you. Thank you.